Hello learners, this session is about surgery one-liner. Let's get started. Rule of 7 is for diagnosing a neck mass. If the mass persists for 7 days, that indicates inflammation. If it is for 7 months, that indicates neoplasm. If it is for 7 years, that indicates that is a congenital defect. So rule of 7 is for diagnosing a neck mass. Smoking protects which intestinal pathology? Smoking protects ulcerative colitis. In ischemic colitis, poor perfusion occurs in which point? In ischemic colitis, poor perfusion occurs in splenic flexure, which is Griffith point. Anal fissure is common in which area? Anal fissure is common in midline posteriorly. Actually, midline posterior is common for males and midline anterior is common for females. In general, common is midline posterior. Next, most common bladder tumor, TCC, which means transitional cell carcinoma. That is the most common bladder tumor. Normal value of residual urine. Normal value of residual urine is 30 ml. BPH is also known as benign prostatic hypertrophy, is also known as fibromyalgia. Most common malignant tumor in men over 65 years. Prostate carcinoma. Most common malignant tumor in men over 65 years is prostate carcinoma. Gleason score is for prognosis of prostate carcinoma. Gleason score is for prognosis of prostate carcinoma. Most common type of teratoma testis. Malignant teratoma intermediate. Most common type of teratoma testis is malignant teratoma intermediate. Migratory necrolytic skin rash is seen in glucagonoma. Stemmer sign is seen in lymphedema. In case of lymphedema, skin of dorsum of toes cannot be pinched because of subcutaneous fibrosis. That is the Stemmer sign. FSH and LH level in obstructive azoospermia. FSH level and LH level are normal in case of obstructive azoospermia. Most common site of urethral carcinoma, bulbomembranous urethra. Urethral carcinoma, most common site, bulbomembranous urethra. Gardner syndrome. Gardner syndrome is composed of polyposis colon, osteoma and epidermal cyst. Polyposis colon, osteoma and epidermal cyst. Left recurrent laryngeal nerve found in which groove? Tracheoesophageal groove. Thank you so much for listening.